371 in medic 6. You're seeing a 74-year-old male, shortness of breath, down at 2 words.
Vast amount of energy is spent in healthcare today, reacting to medical crises and emergencies, taking care of illnesses which were poorly managed or those which could have been prevented. The prognosis for healthcare in our nation is poor. The boomer generation is moving towards retirement with numbers which will create unprecedented challenges for our healthcare industry and our communities at large.
First of all, the demand for our healthcare is so dramatic that we won't be able to, at some point, I fear, take care of all of the sick patients that are going to be coming here. But it's also the absolute right thing to do, both from our Christian imperative, from our community imperative, and that is to really focus and provide health care where people are.
I've had the privilege of working in healthcare administration for over 30 years, and I've been a member of a church congregation for much longer than that. And a few years ago, I was introduced to a thing called parish nursing, and I was excited both as a healthcare administrator and as a church member. Parish nursing provided an opportunity for my hospital to reach out into the community and make a difference in people's lives and to impact their health status long before they had a need for hospitalization, and that was most rewarding.
Parish nursing is a nationwide movement and a specialty practice within the nursing profession. It is sponsored by congregations of all faiths, local hospitals, and other healthcare organizations. The parish nurse is a registered nurse who works as a member of the congregational staff and as a colleague of the clergy.
We are a community that wants to take care of each other. We're concerned about each other. We want to bear each other's burdens, as Paul says in Galatians. And it's a ripe atmosphere for a parish nurse to come in to provide care not just for our spiritual aspects, our spiritual side, but also for our body, mind, soul, and spirit, all combined, because they're all intertwined. You can't separate one from the other.
What we do with the time that we have here on earth and how we take care of our bodies is very, very important. It's not just our spirit that's important, it's body, mind, and spirit.
But I really believe that we pastors, we physicians, we nurses, and everybody should understand better the importance of taking care of this body, because it was created by God, and God was so good, and God trusted us so much that He let us manage this body.
It's exciting to me to see how God works to inform us of needs in the community and the things that we need to be doing. And it's a real blessing to me to be able to respond to those needs and feel that I'm having a part in doing God's work.
But when they see the parish nurse, they are seeing somebody that can teach and can guide them.
The parish nurse can translate health information into the language and practices of the people. The tradition passed down from generation to generation.
Well, it's very rewarding. The feedback that you get from other people is very positive, but just inside you can see the changes that are being made in other people, and that's the reward in itself.
Under the guidance of Joanne Salmons, Senior Executive Officer for Community Outreach, Florida Hospital has been assisting congregations in developing health ministry for more than 10 years. The Center for Community Health Ministry and the Parish Nurse Institute have been assisting congregations to develop health ministry teams and to educate those who wish to serve in congregations as parish nurses.
I would highly recommend this program, and I think you have to get involved in it to believe it.
I really would encourage pastors who are unfamiliar to become familiar with the possibilities that a parish nurse program presents. And for those who might be considering it, I would heartily endorse the addition of a parish nurse ministry to the overall spectrum of programs and ministries offered in the church.
If you're a pastor or faith leader of your congregation, we urge you to look more closely at health ministries and parish nursing. See how these can enhance the work you do to educate, instruct, nurture, and care for your membership. If you're a registered nurse and feel a call to this special ministry, contact us now for more information on parish nursing.